This is the Florida Healthcare Association Provider Program, brought to you by Brouchard Insurance.
My presentation today is to talk about Hurricane Michael and the impact that Hurricane Michael had on nursing home providers in the Panhandle. About 900 people were evacuated from the nursing homes. Long-term wise, 7 nursing homes had to be closed, and 2 were able to come back right away. So that took 712 nursing home beds out of circulation, and most of those beds were in Panama City. In fact, most of the beds in Panama City really did shut down and remain closed because of this hurricane. The total nursing homes on generator power were 18, and about 2,500 residents were receiving their care on generator power, which is a significant number. So damaged nursing homes, as I said, we had 7 that were evacuated, and most of those were severely, either they were destroyed or significantly damaged. 3 are projected to come back in late 2019. 2 are projected that they won't see possibly until 2020, and 1 we're just uncertain whether or not that nursing home is going to reopen. Those residents were moved, and most of those residents were moved to Pensacola, some to Tallahassee, but eventually, too, they had to be moved out throughout northern Florida and central Florida. So these residents are scattered between Pensacola and then probably no further south than Tampa and Orlando area. So they had to be moved quite a long distances from their homes to continue to receive their care. Structural damage, we think it's about $58 million just in the damage to the buildings. That doesn't include the loss of revenue from loss of business or the additional staffing hours and all that. So $58 million, those 7 evacuated buildings, about $46 million, and the 15 other buildings, about $12 million out of them. We think that it's going to be a long, slow rebuild for these nursing homes to come back. We are hearing they are having the same issues that other folks in that area are having out in the Panhandle. There's a lack of contractors who can meet their needs, who are specialized to build a nursing home out that way. There are insurance issues, and there's certainly still a lot of disagreements between the nursing homes and the insurance companies, and they have not been able to settle yet. And the other thing, too, that I think is going to be the biggest problem for these nursing homes to rebuild is getting staff. They are seeing their staff have moved on. They've either moved out of the area, they've moved on to other jobs. So we're going to have to recruit new staff coming on in. And the current base is going to be difficult to recruit from, but when you bring people into that area, like other businesses, there's a lack of housing. And so just trying to find housing for new staff is going to be difficult. So I do see that bed shortages in that area, and I do see it's going to be a long, hard road back for those nursing homes, much like other businesses in the Panhandle. One of the things that you heard all throughout, we Florida Healthcare Association, we did supply convoys out to the nursing homes right after the impact of the storm, and then subsequently. And one of the things that we heard over and over was there will be no more Hollywood Hills. So if there's any sort of silver lining to what happened at the Hollywood Hills nursing and rehab, it's that I think everybody became more diligent that something like that never happen again. So out of all the residents in that area, they were all safely evacuated. All residents were cared for in temperature-controlled environments, and there were no deaths or injuries to any of our residents as a result of the hurricane. I will tell you that the generators were a godsend for these nursing homes. We went out and visited, and the destruction around these nursing homes was unbelievable. And you went inside them, and it was like things were fine. So the generators really provided the safety for the residents and the staff. And I think if there was questions whether or not generators were necessary, I think the storm proves and answers that they served a real purpose. But not only did they provide a safe environment for the residents, when we visited those nursing homes, the staff, the family members, pets, people from the community were all being resided in these nursing homes. In fact, the nursing homes became, if you will, de facto shelters for the community. In Mariana, for instance, people in their homes lost their insulin because their refrigerators went out. They had no power. So the nursing homes were providing care for insulin-dependent people who receive it at home. Our administrator for a Bluntstown facility actually drove out during the storm. He heard that there was a resident who was home alone who was blind, and they brought them in and they sheltered them in the nursing home. So the nursing homes were able to pull people in from the community because of the safety requirements that were put into place. The other thing, too, is that you saw that the internal plans worked during this storm for the nursing homes. Companies had backup generators to the generators. There were bringing in supplies and things like that. All seemed to work. The other thing, too, that was pretty outstanding was the support from the community, emergency planners, regulators, to really make sure that these nursing homes were providing safe care. We saw when we would visit, there was ambulances sitting in the parking lots. We saw they were bringing in water and fuel for the nursing homes. So I think everybody had it on their mind that we were not going to have another episode like South Florida, and everyone from the regulators on to emergency planners all participated in making sure that didn't happen. I want to tell one story about how difficult this really was. So we were in the EOC, the state EOC that night, and the administrator from Community Health and Rehab, which is a nursing home in Panama City, called us and said, the windows are starting to rattle. What should we do? And I talked to the emergency managers, and we relayed it through the corporate. Move all the residents out into the hallway. Well, they moved the residents out into the hallway, and the windows burst, and the water came running in. And the residents were in the hallway, and the rooms were now all being flooded. And all of a sudden, the roof started peeling off, and you had ceiling tiles coming down. Well, the storm passed. They couldn't turn on their generator. You had the residents in the hallway. They couldn't turn on their generator because they had 3 inches of water. We tried to get ambulances or police to them, but right at that point, no one could get to the building. So the company had organized a convoy, and they chainsawed their way and moved power lines, and they got to that building in the middle of the night. They were able to stabilize the residents, and it took us about 2 days or so before we could get all the ambulances in and move them out. But they were all moved out. They were moved out safely, and everybody stabilized them. And that just gives you some sense of the extraordinary efforts that it took to keep these residents safe. Some of the outcomes from it, I'll talk about positive, and I'll talk about areas where we need to continue to do work. I think that the Agency for Healthcare Administration and the Department of Health deserves great credit in their outreach in the State Emergency Operations Center. They bring in the Florida Healthcare Association, the Florida Hospital Association. They coordinate with Leading Age, the Florida Assisted Living Association, Florida Senior Living Association. So we all work together to keep the residents safe. And I mention this because I sit on our National Association's disaster committee with colleagues from other states. And a lot of the other states do not welcome the professional association people into the state EOC or into the emergency operations centers. And it's such a tragic loss because I think, one of the things in a hurricane, you can't have enough people. You can't have enough boots on the ground supporting these residents in the building. And ACA and DOH has done a great job as far as reaching out and working and making sure everybody works together for the residents. Power restoration for this storm was much improved over Irma or the last storms. In fact, we had been in discussions with the power companies as far as communications go, literally the week before this storm hit. And so what we saw was we did see power companies restoring power to nursing homes, keeping nursing homes informed when power is going to be restarted. And there was a lot of good dialogue between the nursing homes and the power companies on that. So that was much improved over previous storms. Some of the lessons learned where we still have challenges is power restoration. We had dialogue with the companies who were involved out in the Panhandle. I think that there's still more work to be done. There's still municipal power companies and others that we have not had discussions with and communications with. And I think there too, we need to continue to have dialogue with the power companies on restoration of nursing homes in the hurricanes. Evacuations, senators, evacuations is really one of the areas where we need to continue to keep working on it. One of the things that we saw in this hurricane, and we see it in every other one, is a a different way of thinking between emergency management and the nursing home providers. Emergency managers, they're looking at a wide swath of people. They want to evacuate. They want to evacuate quickly and move everybody out, whereas nursing homes want to hunker down. They want to harden in place. They want to take care of the residents in the building. And so we still see this disagreement between emergency managers and the nursing home providers as far as when to evacuate. The Senate, the U.S. Senate Finance Committee did a report where they looked at the Hollywood Hills situation, and one of the recommendations that came out of that report was protocols being developed on when a nursing home should evacuate. Protocols, I think, would be a very useful thing. I think emergency managers and nursing home providers need to come together and certainly agree on protocols for when a nursing home should evacuate and when it should harden in place. So that's clearly one area that I think can be looked at. A second area is what we saw was receiving facilities strained, caring for the additional evacuees. We had to move residents out of these damaged buildings, and we moved them to Pensacola and Tallahassee. And you want to try to keep residents as close to home as possible. You don't want to move them any further than you have to. But what we saw was those nursing homes in Tallahassee were getting strained with the care, and so helping those caregivers is something else to look at. And then the transfer trauma from these residents. Residents moved up to 4 times, and I think that's something that's going to be studied, the transfer trauma. The next thing I'd like to talk about is the generator rules. And as I mentioned, we are required to have generators in nursing homes and assisted living facilities. They were supposed to be in place by January 1, 2019. If not, we have to be on a variance. And what I'd like to do is give you an update on where we are with generators. Out of the 682 nursing homes in the state, 214 have the approved permanent generator and fuel storage. 442 have a pending or approved variance, and 26 have expired extensions, although we spoke with many of them, and most of them have their generators in, they're just waiting for a final approval. With the variances, even though they haven't got their permanent generator and fuel in place and approved, they have to have temporary generators and a plan to keep residents cool. So even in the interim, they still have to keep the residents safe. So Florida Healthcare, we did a sample of 50 of the 442 variances as to why. How come you weren't able to have your generators in by now? And again, all of them demonstrated in their variances that they had a temporary plan using portable or temporary generators. 28% are awaiting their generators. These generators, this is just a picture of what these generators look like in fuel tank, just so you have an idea. I mean, this is a tractor trailer size that the generator's on, and you could see the size of a fuel tank. That's something the size that you'd see in a gas station. So these are big. They have to be custom made. And so 28% are still awaiting on their generators or some sort of parts to come in. 18% experienced delays in delivery and installation or electrical wiring upgrades. Electrical wiring really is one of the big issues. What they find is the buildings, the wires are old, and so they need to be upgraded. And then a little bit over 50% are waiting for their reviews, either from local zoning or ACA. And so they're waiting for their government reviews. And I'm not being critical of the regulators at all for taking their time. No one wants to approve a generator that will have carbon monoxide poisoning or fire. So this just takes time to go through zoning and permitting. So what do we expect to see? So 31% of the nursing homes currently have met the generator and fuel rule. If you take the sample of the variances that we looked at, another 20% will meet the rule by March 31st, and then will be over 60% by April 30th. And when we looked at these variances, we should have nearly all the nursing homes or very close to them by June 1st. Most of those nursing homes are close. You know, it's just, again, some of them will be stuck in zoning. So that's where we stand right now on the hurricane and the generators, and I'd be happy to answer any questions.
It's been a great concern to me is the ability of any of these people to communicate. When I was in that area, cell phones weren't working, nothing was working. And it was quite shocking what chaos exists without the ability to communicate with personnel, with other emergency folks, and particularly when you've got this many people, you've got to have doctor's orders moved with them and so forth. But I was introduced to one incident out there where a team brought in what they call the boom box, and that these could be in place at if everybody decided to use this system. But I couldn't believe what order it brought to chaos, and the reports that came back from that one location that really had severe issues about being able to communicate with anybody. So could you touch that just a minute and how that worked in this hurricane?
Yes, Senator. This product called the Boombox was really we saw it in action, and it worked very well. It's kind of like a suitcase, but what you do is you download all your patient's records into it, and so you could transport all that with you, which is very important. The other thing too is even if the communication is down, it creates wireless for the building. So all your electronic medical records work. It has a satellite phone. It's a good product. It worked well out there, and I hope we could see some expansion of that.
You talked about Congress having evacuation protocols, and you said you would like us to have them here in the state. Am I correct? Is that, and if I'm stating that correctly, is that your opinion, and could you help us draw up some protocols that we could have?
There was a report that came out of the Senate Finance Committee on the hurricane, and in the back of it were recommendations. And one of the recommendations was that there be protocols developed on evacuations of a nursing home. So they have not developed it. They just recommended it, and that would certainly be something that I think would be useful here in the state of Florida.
Thank you.
Thank you so very much, and we certainly appreciate all you're doing for our residents in our nursing homes. We want to make sure that they're safe during a hurricane.
Thank you,
and
Senator.
thank you. Appreciate the hard work. Tough time.